At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Early-Onset Dementia and Alzheimer's on Wednesday, December 17th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome to Dr. Tom Roselle Live right here on WMAL 105.9 every Sunday at high noon. And we got a great program for you. One that might scare you just a little bit, but that's my job, is kind of scare you and then show you what you can do about it. What are we talking about? We're talking about dementia. You know, you lose your mind. And we're going to kind of touch upon the subject over the next few weeks, and leading in from here also into our live stream, Ageless Health with yours truly. And we're going to continue the process of talking about this. Is a very important situation because so many of us are starting to lose our sensibilities, our mind, our cognitive capacity, our ability to do detailed situation. Now, is it because it's inevitable? Well, here's the deal. There's about 70% of us after the age of 65 that start really noticing some problems. And is it because it's going to happen regardless, or is it because that there are identifiable situations that can cause the problem? Well, I'm here to tell you that you don't have to end up not knowing who you are. I'm here to tell you that there's things that can resolve it and prevent it in an ongoing situation. And by the way, just so you know, that leads into our last in-house program for this year on December the 17th. And it's going to be 6 p.m. at the Roselle Center for Healing in Fairfax. Dr. Scott Lamp and I will be talking about this specific situation. We're going to talk about dementia, the kinds of dementia, the signs and symptoms leading into it. But more importantly, we're going to tell you what you can do about it to prevent it. I don't know about you, but you know, I've gotten into that place in life where a lot of people, my contemporaries, are starting to lose it a bit. And they think it's an inevitable situation. That's what happens when you get older. And I'm here to tell you that that is not the case. You don't have to scramble for, what was that guy's name? And you can see his face, but you can't remember who he is. There's lots of reasons that these things continue to come about. And I'm going to kind of tease you a little bit. I'm going to tell you that some of the things that you would least expect are causing potentially the dementia. And we're going to talk about several of them, but as we get to the end of the program, so you don't leave me, I'm going to talk to you about two different things that actually, if you understand what they are, can be reversed, that lead to Alzheimer's and very significant cognitive disturbances. So keep that in your brain, and we're going to talk about it before the end of the program and at least tell you what they are. But there are early signs and symptoms of dementia. And if you get into the Dementia Society of America's checklist, they'll start laying them out for you. And some of them are pretty scary, if you will. They give you these clues, if you will. It's a combination, as they will call it, of leading signs and early symptoms, that come about as a result of these progressive, ongoing, oh my God, situations. And, it's information that can generally be noted when, you're in close proximity with somebody that has, these types of conditions, or they're starting to show heavy dementia. But these clues first appear, if you will, as a progression, one stage on top of the other. accept these changes that we think, well, they're just because the person's under stress. Like what? Well, how about unexpected anger? Just get, boom, they're there. How about increasing difficulty in finding the right and appropriate word? Unsteadiness on their feet, or the lack of inhibition. All of a sudden they were, controlled in most social situations, and now they're not. And then if it gets worse, then you talk about delusions and maybe hallucinations and so forth and so on. The inability to judge properly. That's a very, very significant one. Some characteristics of the middle stages, if you will, of dementia include the worsening of the early stages of forgetting words, forgetting people's names. Oh, I forgot where that is. Was I really there? I don't remember the details of that situation. So becoming restless because of that, or then all of a sudden becoming suspicious of others, confrontational, and so forth. All of a sudden, they forget about hygiene. Oh, I forgot to brush my teeth today. So what? No big deal. And this is somebody who was very detailed in their presentation. So when you start seeing things like that, that's initial stages. Sometimes you get swallowing problems later on, and choking problems, and they lose control of their bladder, their bowels, and so forth. What's happening is neurologically, the body is not doing what it's supposed to be doing. And it's neurological loss of memory of the nervous system, not cognizant memory, but there's that other automatic memory that the body begins to break down. But there are very specific reasons that are preventable. Let me give you some of the early stuff, right? You retire, or you're not working as hard as you used to work, but you've been under a tremendous amount of stress for a long period of time. Maybe the stress of what we went through with COVID. There's a lot of people who've suddenly ended up with, uh, we'll call it dementia type of conditions, or forgetfulness, or stress patterns, or unwillingness patterns coming out of dementia, self-deprecation, reactionary conditions. All of those things came as a result of what we went through. Why? Some of it was the fact that this thing really knocked the bejesus out of your mental capacity to function. Some of it came because there were parasites and venom that was in the vaccines. And that's what I was going to tell you about as we went through. And there's one other condition that I want you to know about, and we'll talk about that at the end, that can cause dementia. And they're finding that, in fact, it is, but it's also related to a lot of different cancers. And the brain also has a susceptibility to glial cell cancers, which are not cool. These things can take you out pretty quickly. So what are we talking about? I'm going to tell you. I'll tell you before the program's over. So we'll come back to that in a moment or three. Now, understand that you can stop the majority of these conditions. But again, I want you to think about your lifestyle. I want you to think about the things that you don't do anymore. I want you to think about, what am I not doing anymore that I used to do all the time, and I just don't care, or I don't want to, or, any of those things. But there are early checklists that you can kind of do a punch list on, right? And you need to be aware of them. So when we look at brain food, and is it necessary really that we eat very well? Well, I'm here to tell you, after a whole bunch of decades in practice, that the issue is, yeah, you better well eat the way you're supposed to do, because otherwise it's going to break down and you're going to end up with a lot of these silly preventable situations. So you need to have tons of fresh vegetables that are organic. In today's world, you got to be really careful. You need to have berries, particularly the dark ones, the blueberries, the blackberries, the raspberries, things like that. They have high levels of polyphenols that will help protect your brain. And we have to make sure that we're not getting high levels of fructose. Did you know that Alzheimer's and brain dementia is starting to be known, and has been for a while, as type 3 diabetes. Type 3 diabetes. That's because the brain needs glucose. But if you're eating all kinds of garbage that has high levels of sugar in it and it converts into glucose, now your brain, like everything else, becomes resistant to its utilization and transport, insulin resistance type 3. So that's the area that is showing up. And there's study after study that shows that in fact is at least a minimally a significant contributing factor, but also importantly, that may cause it and particularly optimize and make worse the end stages of this type of situation. But there's other things that sit there as well. What are these early signs and symptoms that we have to be aware of? And remember, coming up on December 17th, Dr. Scott Lamp and I are going to go through and checkpoint these things. We're going to show you, we're going to give you a little test that you don't have to turn in. Nobody's going to see it, but just for your own good, you're going to be able to see what these things might be doing in accumulation over a period of time. So unfortunately, forgetting recent conversations or appointments is one of the early signs of dementia. I don't know about you, but sometimes I get into a conversation because I'm constantly talking to people all day long, and I'm on calls, I'm on consulting, I'm on the stage, I'm doing all kinds of things like that. And I often will forget details of things that I say are not totally essential or necessary, but that's me doing a screening process. Now, in your situation, in our situation socially, if I have a conversation with my wife or I have a conversation with one of my children or grandchildren, and they come back and say, Grandpa, do you remember blah, 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 blah? And I'll look at them like, why don't you remind me of what we talked about? That's a problem. That's because it was something that should have been important to me and that I could have disengaged and have been ADD and my head was someplace else. That's one thing, but you have to rule that in or out. And the other piece of the puzzle is that there's something not working the way it's supposed to. That's an early sign of dementia. How about struggling to find the right words? Not necessarily forgetting, but how about if uh, you get in a conversation and you pause mid-conversation, you try to remember a simple word, and then you have to substitute it with something else, a phrase, or you use the wrong word and you're kind of out of context with it. And you have people look at you like, what did they say? What was that really all about? So that language barrier, we can call it a language barrier, could be an indicator that something's not working right with your brain. Now, but it also could be really high stress level, and your brain needs just to be calmed down, or it's burning up the nutrition that it needs to have, the neurotransmitters that we touched upon. All of those things are critical in making sure that the brain works the way it's supposed to. And if you're not taking care of yourself, that brain of yours is not going to work the way it's supposed to. How about misplacing things? We're not talking about leaving the keys in the refrigerator, which would give you a significant concern. But how about, and I do it on a regular basis, I'm at the house and I'm flying around and so forth, and I'll put my key bob on top of the banister, and I go upstairs, to change a jacket or put a suit on or whatever, and I go back downstairs and say, where the heck did I put this thing? And then I realized that I put it on the banister, and it takes a while. Or I go out in the car thinking I got everything in my pocket, and I forgot something, and I go back in. Those can be early stages, but it also can be just because you're under a tremendous amount of stress, you're moving too damn fast, and you're not putting things into sequence. One of the other pieces that we notice with a lot of people that are beginning to very much show signs of mental confusion, dementia, are mood swings or personality changes. And sometimes you get to an extreme. That's a problem. Something that is not very normal or has never been seen before. They get upset easily, or they're angry, or they're anxious without seeming cause. And it can often be overlooked because, well, it just is the way it is. But when those personality changes start showing up, it could very well be an early signs of something much more significant, very serious. It could be that the brain is deteriorating. It could be because of what? Because of exposures to heavy metals, to toxins, the things that are run off in our water supply, the chlorides and the fluorines, the inability to support mitochondrial function. Those are your little energy packs that produce the muscles and neurological transmissions of the heart and the brain and other systems, but those are the top two. It could be that. It could be a problem in that situation. So if that's the case, if we start seeing that situation, got a problem. How about if you get in a conversation, all of a sudden your head goes into a different place, you start thinking something else, and you come back and you forgot what the heck it was that you were talking to this person about. That can be one of two things. That can be ADD coupled with stress, or it can be significant, but you got to get it checked out. A lot of these personality deficits, a lot of these things are often set aside as PTSD, post-traumatic stress disorder. Now, stress can be physical blow, or it can be emotional trauma, ongoing emotional upset that just never goes away or never dealt with properly. Either way, it affects the neurological transmission. Why? Couple things. The brain remembers upset and goes to a place of the brain called the limbic system. That's where your emotional platform is. But it also can be triggered by the inability to make sure that you have adequate amounts of the right nutritional supply of certain neurotransmitters in your body. And so what does that mean? So that means that your intestinal tract, your microbiome, the good bacteria that should be there, isn't producing what it should be producing because you're putting all kinds of garbage in there. You've been on so many damn antibiotics over the years that, it's been part of your normal track. Or, it can be that, you're putting sugars and sodas and coffee and black teas and fast food and fried foods and all the garbage in there ongoing without a break. And you don't put anything that's wholesome. And you're not going to organic foods and free range foods. Your mold level is going through the ceiling. You're developing aldehyde, which is an alcohol, which affects the brain. Aldehyde comes from mold, my friends. But when you start seeing these changes that take place, that's a problem. What happens if you have difficulty following simple conversations or directions? If you find it harder to follow along in a conversation, or struggle to remember directions, could be a couple things. Could be your ears. Could be you're losing your hearing. And that's very typical. But the problem is it begins to lead to cognitive dysfunction. Go get your hearing checked. Find out. Did you know if the upper part of your neck is out of place, that can cause problems with hearing? Because that's where the nerves that allow you to hear, that go to your brain, that's where they're involved. That's where they come down. That's where they can be potentially irritated. So if that upper cervical spine, that's cervical 1, 2 vertebrae, and your skull is not in the position it needs to be, you can have some of those inabilities to start taking place. Can't hear, can't think, can't remember. You get in a conversation and somebody says something at a very low level, and all of a sudden you disconnect because you're scrambling with those first couple words. What happens if your vision is off and all of a sudden you can't read as quickly as a few years ago, some of you knew that I had a pretty significant blow trauma to my head, and things started getting a little off center. A lot of people tell you that was normal for me, but no, not really. And I started not being able to read. I scan at least very quickly. And I used to love to read data. Most of it's professional, and a lot of it is business, and a lot of it is reading stories about guys who created and did things at very, very high levels. But I stopped doing a lot of that in the initial couple years after the trauma because I couldn't assimilate data as fast as I used to assimilate the data. So when something like that happens, if you ignore it and you don't get it taken care of, you have a problem. There's something called injury recall technique that we use all the time with our patients that have those types of things, just to see if it's there. But going back to the gut, the microbiome of the intestinal tract, the microbiome of the gut is what produces your neurotransmitters, 80% of them. And those are the things that affect your nervous system, but it also affects your brain. There's a lot of literature out there that's going to say that it doesn't cross the blood-brain barrier, meaning it doesn't get into the brain, but it does. Current research shows, in fact, that it will do that. So if that's the case, wouldn't it be prudent in someone who is not doing well, or even in ourselves, we start seeing these personality changes, these mood changes, this misplacing of items, the language patterns that we forget about, and so forth. Those are the early signs. Forgetting, where you put your keys or had lunch yesterday, you have to stop and think about it. Those might be early signs, or what you had for dinner, Monday night, and it's only Wednesday, or, a conversation that you had that somebody's got to remind you of. Those are little signs, but you have to look at the exposures. Number one, what's the lifestyle been? Is there in fact dementia and mental shrinkage of the brain, and subsequent mental shrinkage of the brain? You find that with, imaging. But here's the deal. Most of this stuff, if you catch it early on and you realize that stress, dietary patterns, inactivity, unwillingness to learn new things, your brain is a muscle like any other muscle in your body. And if you don't use that muscle, it weakens, period, end of story. It weakens. So you have to be willing to step up to the plate. The 17th of December, the last in-house program that we will do this year at the Roselle Center in Fairfax, Dr. Scott Lamp and I will go through step by step the early signs of dementia, but more importantly, what we can do about it, what you can do about it, what needs to be done, how you can prevent it. And I promise you, you're going to walk away with a ton of data. And if you use it, just from the things that we're going to give you that night, if you use it, if you're willing to put it into place, you can begin to change so much that is going on in your life. If you're not willing to change, if you're not willing to make a difference, then, it's on you, right? Then suffer the consequences, unfortunately, of the things that will show up and that you may suffer from needlessly, in my opinion. Now, there are some things that you need to know about. And as we go through the process, we'll tell you, yes, you need to have this checked out. Yes, you need to do something about it. Yes, you need to really get involved. But here's the deal. So if you can change something, number one, will you? Well, we're going to give you the data to find that out. Are you willing to step up to the plate and say, yes, something's not normal here, and then do a housekeeping checklist? But there are tons of little signs and symptoms. Now, I told you that by the end of the program that I give you another piece of the puzzle that has to do with the brain and something that we've used ongoing. And this has to do with Alzheimer's. Alzheimer's has been found to be triggered by viruses. Two things, viruses, and remember I said earlier, type 3 diabetes. That means that the blood sugar levels are too high in the brain. But if it's a viral element and it's gotten into the brain, it's crossed the blood-brain barrier, what can be done about it if you catch it early on, and is the way to test it? Short answer is yes, there's a way to test it. And there's a product that is derived from the oleander plant that can make a huge difference in dementia states. We've used it for a lot of things. We used it during COVID. It comes from a company called Phoenix Biotechnology. And we're going to talk to you about that on the 17th. We'll show you exactly what can be done. So this is your opportunity. Now follow me. We're getting ready to go into the live stream. Remember, you can always reach out to me at drtomroselle.com or rosellecare.com and make sure that, you ask me the questions that are fresh in your mind and you need to know. Remember, I'm here every Sunday, high noon in Washington. One reason only. I love you all. Have a great day. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Early-Onset Dementia and Alzheimer's on Wednesday, December 17th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.